name's Jessie.
My name's Olivia.
My name's Elizabeth.
And our topic is Dr. Lillihei and open heart surgery. I understand the risks of the surgery are extremely high, but I'm still a little hesitant.
Before 1952, all I would be able to offer you was to eat more vegetables or drink more milk. But after Dr. Lillihei perfected the technique, now there's a way for me to actually help cure your heart disease. I think if you were to research him, you'd feel more assured with the procedure.
Okay, I'll look into it, but could you tell me more about him now?
Sure. Dr. C. Walton Lillihei was a doctor in the mid-1900s. He died at the age of 80 on July 5, 1999, leaving behind a legacy. He led an evolution in medical history by developing and advancing medical procedures that involved opening the heart. Because of his discoveries, we now have efficient and reliable options for cardiac surgery. He saved the lives of many by his medical work and discoveries.
We need to find a solution fast. The patient keeps getting worse. Our typical treatment isn't working anymore.
There's nothing we can do. We aren't completely sure what the cause is, much less a solution.
We've had many cases like this in the past. The patient rarely survives. It's time we start doing something different.
How can we do something different when we have no other options to turn to?
I disagree. How can we keep doing the same thing if we want to progress?
In the early to mid-1900s, there was no way of operating on the heart. A lot of people died because they needed a surgery that had not yet been discovered. Patients had little to no options for treatment. Doctors did not know the cause for heart attacks and heart disease until 1946. They discovered it had something to do with what they were eating. The only options for treatment they could give their patients were to eat more vegetables and drink more milk.
Dr. Lillihei further improved the method that they used for open heart surgeries. They would connect the patient to a donor that would keep their heart pumping through their bodies. However, Dr. Lillihei was not the first one to attempt this theory. He got the idea from a German doctor named Ferdinand Sauerbruch. Dr. Sauerbruch said, "My heart was pounding. There was sweat on my forehead, for I knew I had brought something off that would be of benefit of many, many people."
Right this way, ma'am. You may have a seat. I have recently been experimenting with a new surgery. It has not yet been attempted on humans, but it has worked a number of times during the experiments.
This sounds extremely risky. What does it entail?
Yes, it is risky. We will need to connect your son to a donor. The donor is typically a relative, a son or a father.
Why do you need another person for the procedure?
When we connect your son to the donor would be taking over the basic heart and lung functions so we could operate on the heart without too much blood flowing into it.
All right. Perhaps my husband could be the donor.
Dr. C. Walton Lillihei participated in the first open heart surgery. It was led by Dr. F. John Lewis, March 26, 1954. It was performed on a 13-month-old child named Gregory Glidden. Gregory had a birth defect that caused his heart not to function properly. Open heart surgery gave Gregory and other kids like him a second chance. However, some surgeons objected to this because they had a very vague idea of what the outcome could be.
You cannot possibly be considering this. This is in no way safe. We don't even know the outcomes.
Yes, all of what you are saying is true. However, there is no other option for the patients. We can't find the cure if we don't experiment.
Sir, does this mean I can continue with the surgery?
Go right ahead, doctor. Are you sure about doing this? We don't know what the outcome will be.
Dr. Lewis and I are fairly certain this will work. We need this to work. We do not have nearly enough options for treatment for the patients.
We only have a 10-minute window provided by the hypothermia.
Scalpel.
Clamp.
Hello, my name is Dr. C. Walton Lillihei. Open heart surgery is a procedure where we go into the heart to fix a defect or clear the heart valves. We start by putting the patient under a general anesthetic. Controlled cross-circulation is used for achieving total bypass of the heart or lungs. We lower the body temperature to lower the blood flow by causing the patient to have hypothermia, but not enough to leave permanent damage to the body. We do this because we need to be working with a blood-free intracardiac operating field. This reduces the amount of blood returning to the heart. An electric blanket is placed beneath the patient in order to keep the hypothermia from killing them. We then proceed to make an incision in the chest in order to reach the heart.
This was the first documented open-heart surgery in the world. It left a huge legacy in history. However, sadly, 11 days later, Gregory had died. His death was due to pneumonia that had been caused by fluid leaking into his lungs during the surgery. When the nurses found out of Gregory's death, they were devastated. Over the time they spent taking care of Gregory, they had all grown fond of him. Dr. Lillehei's first patient, Gregory, would be recognized worldly, but soon Dr. Lillehei's next patient would be more known.
Nurse, the patient needs open heart surgery right away.
Okay, I'll prepare the surgical instruments.
Scalpel. Clamp. Forceps. Sponge. Sutures. Gauze.
This was the very first successful open heart surgery in the world. It took place on April of 1954 at the University of Minnesota. However, the patient, poor old Pamela Schmidt, needed cardiac bypass surgery to keep her heart valves. Her disease had been cured and she survived. She was later given the title Queen of Hearts.
After this surgery was released to the press, everyone had praised Dr. Lillehei. He was given a lot of the credit for the surgery, and he became a very famous doctor. This surgery became one of the most common surgeries in the mid to late 1900s. Earl, I have come to you with a new request. See, most of my patients are children around the age of 10. 60 volts is much too strong for them, and they have become afraid of the treatment. I need your help to create a pacemaker that will be more suitable for children.
This sounds like a challenge, but it's a challenge I'm willing to face.
After Dr. Lillehei's 100th surgery, he noticed that the deaths were not caused by the surgery, but by the heart trying to regulate its pace afterwards. He had then gotten into contact with Earl Bakken, who invented the very first pacemaker. They worked together to create a pacemaker that would be easier for children to carry, and it would be battery-powered. In 1958, Dr. Lillehei inserted the very first pacemaker through a surgery. The pacemaker fixed the problem and reduced the death rates.
We have finally finished making a pacemaker that transmits no more than 5 volts into the patient.
This is incredible. Many people would have believed we could not do this, but what mankind can dream, research and technology can achieve. Thank you so much for your help, Mr. Bakken. Hello, it's Dr. Lillehei, just checking in again. Over time, we have progressed greatly with open heart surgery. I have done much work at the University of Minnesota developing medical technology. We created a bubble oxygenator that replaces having to connect our patient to the donor. The general outline of the procedure stayed the same, yet it improved greatly. Since we now have a portable pacemaker, we added that into our surgery. We sewed the wires of the pacemaker into the patient's heart at the end of the surgery. The patient would then return after the damaged cells in the heart had been repaired to get the pacemaker removed. Wow, Dr. Lillehei left a huge legacy in medical history. I'm so thankful for the fact that he took such a huge leadership role in his research and surgery.
Yes, he was a great leader. Did you know that he himself performed over 160 surgeries?
That's incredible. It sounds like he did a lot of amazing work with his life.
Yes, he did. I admire his leadership very much. We have made so much progress in the medical field because of him. He inspired me to become a surgeon.
That's nice. How does this affect my surgery now?
Well, you see, Dr. Lillehei found a way to operate on the heart. Now, the heart is a very complex muscle and can have many complications with it. Being able to open it and fix what needs fixing has saved the lives of many, many people.
That truly is amazing. Just one more question. How does it save lives?
Open heart surgeries are used so often today. One of the most common surgeries needed is cardiac bypass. We could not do this without opening the heart. One of the main reasons our child and infant mortality rate has gone down so much is because we can now go into the heart and fix many defects children have.
I had no idea the impact it made on all of our lives today. Thank you so much, Doctor.
Dr. Lillehei led the research and discovery to an evolution in medical history. He left a legacy by creating a way to perform what is now called cardiac bypass surgery. That legacy has survived today by his 3 sons, 2 of which are deceased, his daughter, and his many grandchildren.